Okay, I think all we know that primary immune thrombocytopenia is the most common form of hematological disease in children population, and it's characterized by a low platelet count due to platelet destruction by the immune system. Bruises and bleedings from various sites are the most common manifestation of ITP in children. You can see the incidence that it's 50 cases per year in 1 million children population. The aim of our study was to identify the incidence of ITP among children who receive treatment in hematology center in Armenia, the sole center who provide specialized treatment for children with ITP and all hematological malignancies. The study focused on analyzing the data of children treated at this center between January 2016 until December 2020. By determining the incidence of ITP in Armenia, the study aimed to contribute the understanding of this condition and its management in the local population. A total of 176 children aged 18 years and younger were included in our study, and you can see that 55% were male and 45% were female. The median age group is 3.75 years, and to gain a comprehensive understanding of ITP across different age groups, the study population was divided into three groups. The first, less than 1 year, you can see that here we have 30 patients. It's like 70.6%. The second group is 1 per 5 years, and we have 78 patients, like 44%. And this third group is patient older than 5 years, and we have 67. It's like 38.1%. The IVG describes 3 phases of thrombocytopenia. It's newly diagnosed ITP within 3 months of diagnosis, persistent ITP, patient who don't not achieve stable remission between 3 and 12 months after diagnosis, and the second is the third is chronic ITP, continuing for more than 1 year. ITP was formally classified also as mild, moderate, and severe, but not every time that it correlates with thrombocyte level. And IVG proposed that the term severe ITP only be used for patients with clinically significant bleeding requiring additional therapy, regardless of platelet counts. So in here are symptoms in our study, the symptoms for patient, and understanding of range of symptoms associated with different types of ITP is vital for prompt diagnosis and appropriate management. In this stage, you can see that most common symptoms is purpura, bruises, and oral bleedings, but also we have some patients with gastrointestinal or bleeding or hematuria. So that's our study results. In the first age group, less than 1 year, the majority, like 19%, were newly diagnosed cases, while only a small proportion, like 10%, had persistent ITP. In this group, we haven't any cases with chronic ITP. In the second group, we have 82% of patients with newly diagnosed, and 5% had persistent ITP, and just 30% had chronic ITP. And in third group, we have a group then older than 5 years. We have 58% newly diagnosed, and 10% has a persistent ITP, and just 31% had chronic ITP. The median platelet count, the analysis revealed that the median platelet count observed in the study population was 6,000. This measurement indicate the middle value of the platelet counts recorded among the patients, including in this study. Also, understanding the median platelet count provides valuable clinical information regarding the severity of thrombocytopenia regarding the in patient with ITP in Armenia. And our treatment, first line treatment, The primary treatment approach to pediatric primary immune thrombocytopenia was the use of corticosteroids. Corticosteroids are commonly prescribed at the first-line treatment due to their ability to suppress immune activity and increase platelet production. In our study, sorry, I forgot because I changed here. I forgot about this. Okay. You can see that median platelet count was 6,000. And yes, first-line treatment. Out of the total study population, a significant majority of patients, specialty 148 individuals, received corticosteroids as part of their treatment regime. We have another regimes too. You can see that corticosteroids is more common, and we used also IVIG. We have patients who don't receive any treatment, and we have symptomatic treatment like entamzylat or ascorbic acid. And in past few years, we start to use L-Thrombopag also in some cases, but not for first-line therapy, just not for first-time therapy, just for a second line or third line after corticosteroids, IVIG. We use two dosage of corticosteroids. Is prednisolone 4 milligram per kilogram for 7 days. 60 patients we treated with this dosage. And we have also the second is prednisolone 2 milligram kilogram for 2 or 3 weeks. And you can see that 89 were treated with dosage of this dosage. Following the initial course of corticosteroids treatment, the study observed an increase in platelet count in 106 patients. This suggests a positive response to corticosteroids therapy with a significant number of patients experiencing a rise in platelet levels. We have also the surgical option of therapy, it's splenectomy. We use it very in the few cases. Our 4 patients with chronic ITP underwent splenectomy. The surgical intervention was performed as a last resort to improve platelet counts and reduce the severity of thrombocytopenia in these individuals. The decision to proceed with splenectomy involves careful consideration of the risk and benefits, as well as a thorough evaluation of individuals' patient characteristics. While splenectomy can be effective in increasing platelet counts, it is not without potential risks like bacterial infections and vaccination and prophylactic antibiotic therapy are often recommended to mitigate these risks. And our conclusions, the study findings contribute to the understanding of pediatric ITP in Armenia, providing valuable insights into the incidence and management. Accurate diagnosis, classification, and tailored treatment strategies are crucial for optimizing patient outcomes and improving quality of life. Corticosteroids remain the primary treatment option, while alternatives are considered for non-response cases. Splenectomy, though effective, carries risk, and measures like vaccination and antibiotics are essential. And despite the retrospective nature of the cohort, the ITP incidence all aligns with literature reported ranges. So in the conclusion of this retrospective study, sheet slides on incidence, classification, treatment approaches, and outcomes of pediatric primary ITP in Armenia. The findings align with existing literature, emphasizing the significance of accurate diagnosis, treatment, and ongoing research to improve the management for this condition. So thank you for your attention.